Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In this presentation, I'm going to demonstrate a wire bending technique for Facebows. Facebows come pre-formed from the manufacturer to some extent. They consist of two parts, the inner bow and the outer bow. The inner bow is the section that requires all of the wire bending. The first step in the formation of a Facebow is to place a scratch mark on the solder joint area to indicate the superior aspect of the Facebow. In other words, the side that's going towards the patient's upper lip. 139 bird beak pliers are used to adapt a Facebow. The first step is to expand the anterior portion of the inner bow so that it adapts roughly to the labial surface of the anterior teeth. The flat base portion of the 139 pliers is used for this procedure. A second bend is now needed at the cuspid region to swing it distally. You mark the wire where you want the bend to be placed and make the necessary bend. Place the Facebow wire deep in the plier beaks and bend the solder joint side of the Facebow in order to make a bend in this thick portion of the inner bow. The wire sweeps to the distal. It should be adapted to be 5 to 6 millimeters away from the incisor teeth, and it should be about 2 to 3 millimeters away from the labial surface or buccal surface of the bicuspid teeth. The next step is to make a bayonet bend, and you mark the wire just at the mesial of the molar buccal tube. To make a bayonet bend, you grasp the inner bow at the mark and bend the wire inward. The beaks are placed just distal to that first bend, and an outward bend is made. Bayonet bend provides a stop to prevent the Facebow from sliding too far into the tube. The bayonet bend stops the Facebow there. The same procedure is used to make the bayonet bend on the opposite side. The opposite side bayonet bend has been made, and the wire has been cut off that extends distal to the distal end of the buccal tube. The end of the Facebow inner bow is rounded with separating discs and rubber wheels. The next step is to adjust the wire for passiveness. You make bends at the bayonet bend area as needed to create a situation such that the wire rests passively directly over the top of the buccal tube on each side when it's engaged in the opposite side. We'll place it in this side and check the passiveness on the other side of the arch. There, the wire rests passively, just lingual to the buccal tube. The final product, Facebow, should be 5 to 6 millimeters away from the labial surface of the anterior teeth. It should sweep inward as it extends posteriorly to be 2 to 3 millimeters away from the bicuspid teeth. The bayonet bends should be small. They should be involving approximately 1/8 of an inch of wire. And the Facebow must be passive and it must be symmetric. In other words, the solder joint has to be centered. Lastly, the inner bow should be parallel to the occlusal plane, and it should be parallel to the outer bow of the Facebow.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.